Hi, Dr. Subialka. It's Hannah Hansen, Rachel Cantu, and we are here doing our skills check case. We have chosen to do case 2. Bruce Wayne is the 65-year-old male who's presenting with low back pain of insidious onset. The pain is primarily on the right side of his low back and radiates slightly into his right buttock. He's got difficulty squatting, lifting heavy, feels good when he sits, difficulty walking, decreased lumbar extension, and that's as painful. He feels better in flexion. He's got some trunk flexor, and extensor weakness, a little bit of hip strength weakness, and some postural abnormalities. So we are just going to go through this, and we are each going to do our beginning progression, and then our middle progression, and then our end progression for Mr. Wayne here. So my first exercise is going to be a single knee to chest, progressing into double knee to chest for this patient. I'm going to be looking to do this 10 times for 3 to 4 sets. But really I want to get a baseline with this patient first and kind of see how much he can tolerate, since that's really going to kind of dictate the course of progression. This should feel good though, so in theory he can do it as much as he wants. This should alleviate pain, but once again, making sure that you communicate and are just engaged with the patient to make sure that you guys are on the same track. But to start, so Mr. Wayne, my first exercise, I'm just going to demonstrate standing here, but you're going to bring you're going to be laying on your back, one leg up, and you're just going to kind of pull it up. So if you want to flip your legs up, I'm going to come behind you here, and I will help you with this to start. So we're going to start with your left leg, since your right side is more progressed. And we're going to lift your leg up. Just give yourself a nice little squeeze there. All right, and then you let go, and then you bring your leg back up. Squeeze. Like I said, doing this 10 times, and then we can switch to the other leg. Bring the leg up. Squeeze, great. Back down, back up. Okay, that was my first exercise progression for Mr. Wayne. Rachel's going to take over now.
Okay, so again, focusing on how he likes flexion and is more painful in extension. My first exercise that I want to do with Mr. Wayne is cat-cow, really pushing into that flexion just to help him feel better. But I do also want to push into extension a little, like nudge into just where he starts to feel just a little bit, not pain, but just feel something, and see if he can nudge into it and make it feel better or not. So again, this the progression and how many he's able to do is going to be dictated by how he feels. However, I do want to start with 10, do a check-in, see how he's doing, and if he does have no symptoms, we want to do 2 sets and then maybe progress on more to that. So right now, Mr. Wayne, if I could have you, first we're going to be on your hands and your knees, and I want to make sure that this is a comfortable position for the patient. Are your knees and are your wrists okay here? Okay, great. And so for cat-cow, what we're going to do, we're going to start with cat. So what I'm going to have you do is try to lift your belly button up to the ceiling, really round your back out, and just push until that feels good. Hold that for about 2 seconds. And then we're going to come down and try to bring your belly button down to the table, get an arch in the back, and how are you feeling here? And if you feel any symptoms, you just stop to where that point is, hold that, and then we're going to go back up to cat, and then back down to cow. And that would be my first exercise for our patient here. Good.
Okay, and then for our second exercise, I'm going to start working on that core strength. Core work is always really important, especially with low back pain patients, and he did say that he has, or the case says that he does have some trunk flexor strength deficits. So we're going to start with planks. And once again, for dosing and progression of these planks, it's really dependent on where his baseline start is, because I want to do planks for time for more of an endurance exercise. But it's hard to know without seeing the patient right in front of you and having them practice doing the plank to see how long they can hold with good form. But just for purpose of this case, we're going to say that Mr. Wayne can hold his plank for 15 seconds before he starts to lose his good form. All right, Mr. Wayne, we're going to start on knees, but I'm going to have him come onto his elbows and then onto the knees, making sure that your back is nice and straight here, making sure that core is nice and engaged. You want to be squeezing your tummy, but making sure that you're not rounding through the back. This looks great. How are you feeling, Mr. Wayne?
Great.
And how are your symptoms right now?
I don't feel symptoms.
Don't feel symptoms? That's what we want to hear. Okay, let's say that was 15 seconds. Okay, you can relax, Mr. Wayne. And then I would want to do this 3 or 4 times at that 15 seconds, and then slowly progress to add more time as his strength increases and he's able to hold this for longer durations.
Okay, and coming back, so I would want to work for my second exercise with Mr. Wayne is bridges. We do have some hip strength deficits, and also just want to help strengthen whenever we have a patient with low back pain. The glutes is always a good area to target. So for my bridges, we'd want to work on a strength, so I would have him do sets of 12, and we're going to do 3 rounds of those, see how he feels. And again, if this is too easy, we can always increase however many sets he does, or add holding a weight or anything, but we're just going to start out without a weight. So Mr. Wayne, I'll have you lay on your back for me. And we're going to have your feet about hip width apart, good. And then before we start the bridge, what we want to do is make sure that the core is also engaged. So we kind of want to move him into a little bit of a posterior pelvic tilt. So Mr. Wayne, what I'm going to have you do, I'm just going to put my hand right underneath your back here and try to press down into my hand. Perfect. Now what we're going to do is lift our hips up. You're going to squeeze your glutes and lift your hips up towards the ceiling. So push through your heels, lift your hips up. Good. And then come on back down. And we again would want to assess for patient symptoms, ask them how they're doing, and just making sure that they're really engaging their glutes while doing this and keeping the core nice and tight. Nice job, Mr. Wayne.
Thank you.
All right, good job there.
Okay, and then for my final exercise, I'm just going to move the camera here. We don't need our table anymore. I'm going to be doing core walkouts with rotations because he said that he does have difficulty walking, and honestly, you have to walk everywhere in life, but making sure that, once again, we're still working on engaging that core, we're adding a little bit of upper extremity strength, we're working on that hip strength, while also adding a steppage progression in there as well. Starting with 15 per side for 3 sets. Like we have already said though, it really depends on where his baseline is. This can be modified, and making sure that he is still pain-free going through this range of motion. Okay, maybe I think the easiest if we go. Yeah. Okay. So we're going to be here. So Mr. Wayne, I'm going to have you, first of all, we're going to make sure that your core is engaged. Making sure, too, before we start, that his hips are in good alignment, that his core is engaged, but he doesn't have his hips too much rocked backwards. Just nice, strong core, kind of like you're taking a deep breath and holding it there. Hips are good. Then you're going to bring your arms straight out in front of you, and I'm going to hold like I'm the wall. And then I'm going to have you walk out towards the camera. Okay. Taking 2 steps out. Great. And then can you keep your arms straight for me? It's a little difficult with this. I'll give you a little bit. There you go. And then 2 steps back. Great. And then 2 steps out. And then 2 steps back. Making sure those arms stay straight. 2 steps out. And then 2 steps back. Okay, and then we'll demonstrate on the other side, just to keep things even. Okay, once again, that core nice and engaged, arms straight. Oh, we're back. Okay, we're back in action. Sorry, I can just cut that out. Okay, arms nice and straight. There you go, and then back, and then out, and then back, and then one more. Like I said, I would like to do this for 15 times, 3 sets per side, but I'm just going to demonstrate 3 for now. So that was my third exercise.
Okay, and also in the case, it stated that Mr. Wayne has difficulty squatting and lifting heavy objects. So for my third exercise, I would want to do a squat progression. And first, we would want to just evaluate Mr. Wayne's squat and see his lumbopelvic rhythm, see if there's any alignment issues that we need to address before adding in any lifting of like heavy weights or even lightweight. So Mr. Wayne, first we're just going to do just a regular squat. So I'll have you turn and face me, and I'll demonstrate for you just quickly here. So your feet are going to be about hip width apart, and we don't want our knees to fall in while we squat. We want to keep our knees in line with our toes and facing forward and keeping our chest up, and then we'll just squat to where you feel comfortable and then come on back up.
Oh.
So good, we want to make sure that Mr. Wayne's toes and knees are not coming too far forward, that he's engaging the glutes while he stands up, and while making sure that his core is nice and tight, so when we do add in lifting into this squat, he's already set up for success. So for this progression, what I'd want to do is we'd want to do this for strength, so I'd have him do 3 sets of 8, while doing the squats, and then if we wanted to, we could add in, just for sake of this video, I'll have him, let's say, come down to the ball, lift the ball up, good, and then set it back down. So, Mr. Wayne, if I could have you demonstrate that. Good, so he's keeping his chest up, and then we'd work our way up to lifting heavier objects, since he is having the difficulty doing that. So I'll have you do that one more time. Nice job. So those are the progressions that we both have for our patient, Mr. Wayne. Do you have anything else to add?
Oh, I think that was it. Thank you so much for watching.